All right, welcome. Thanks everybody for coming. Like Mickey said, my name's Gary Allen. I am a psychologist. I typically work at the Neuroscience Center, but also at Regents Hospital. And so my job is to see patients, and I see lots of patients that have had strokes. I'll see them in the hospital for kind of an initial intake session. We'll support them while they're here, and then we also follow them outpatient at the Neuroscience Center. So Mickey invited me to come, and I'm happy to be here and talk a little bit about some of the different mental health changes that happen after stroke. So I always like to start presentations by saying, like, what are we going to talk about? Like, why might I care? And if I do care, what can I do about it? Because that's what I want to know if I'm the listener. So we're going to talk, when we say mental health changes, we're going to really talk about those changes in the way that people think, the way that they feel, and the way that their life might be going, the way they behave after they have a stroke. And that's important, I think, because these things are very common and they have a big impact really on how people recover from their stroke, what their life ends up being like, and also they can affect having future strokes, which of course we want to prevent. And so what are we going to do? We're going to learn some different signs and symptoms of those, some of the common things that happen, and ways that people can cope with that. So I always like to start out also by saying that, these changes that we're going to talk about today around anxiety and depression and all these changes in thinking and feeling and behavior, they're all very normal after stroke. And we'll put up some of the numbers about just how common these are. But all of these things, I think of them as no different than someone having difficulty with their walking or their hand or their speech. They're just another change in the brain, another result of adapting to stroke. So these are very normal. And I like this quote from a famous physician and psychotherapist, Alder, that says, the only normal people are the ones you don't really know that well. And then here's the Simpsons character over here, Ralphie, saying, I'm normal. So just the idea that, almost everybody I meet experiences some of these changes after stroke in one way or another. And that's because, oftentimes, as you all know, when you have a stroke in your life, it's a pretty major event. These require a lot of change, a lot of adjustment. They come on suddenly, they're quick, and it's just like oftentimes people wake up, and then the next thing you know, you're in the hospital. And so you see these kind of stages of change that you might be familiar with, that people go through, like when they're grieving, right? There's a lot of shock and denial of like, oh my gosh, what the heck happened? And a lot of emotions that come along with that. And then people, kind of work through, hopefully, and come out the other side of that, where they learn to take on this new normal, explore some new opportunities and strategies that they can use to cope and hopefully adjust and, go on to have very meaningful, very happy lives. And one thing I kind of like this visual right here because, normally when we talk about the grief and the adjustment of like, that people go through around losing someone, around death, right?
No,
We
I'm
think of
on
it,
a Zoom call. I'm on a
we think
Zoom.
of it as that, just gonna mute here. Uh, we think of it as that staircase, right? Like we start at the bottom, we're kind of in shock, and somehow we work our way up to magical acceptance land, and then we're done, right? And that's really not the way we think of it anymore in psychology. We don't think of it as this stage model. I like this little image here. I tell people it's not like a staircase. It's more like one of those old school spiral staircases you might have seen in like your grandma's house, right? When you're going through change and adjustment, it's not just like it's getting better every day, right? Normal change, normal recovery and stroke looks more like, this. There's ups and downs, right? There's fits and starts. Or it's like this, where you're kind of going around and you're making progress and you're feeling pretty good. And then, like, wham, something comes around and hits you again. And then you're making progress, you're getting a little further and you're going up. And then, like, wham, it comes around again. So, the point is, like I said, on this next slide here, is that this change, this adjustment to these mental health issues, it's a process, right? As you know, it takes a lot of time, right? We usually, a lot of times we'll say, hey, people are going to continue to make these improvements and notice these changes for like at least the next year, right? Their brain will still be changing. Some of the new research is even like 18 months, 24 months, we're still seeing changes in the brain after stroke. But it takes time, right? And like I said, it's never perfect. It's never just like better every day. It's not linear, right? It's a real jagged kind of curve that people go through. And while they're doing that, it's very easy to get disheartened when you have setbacks, right? But I try to tell people all the time in the hospital, if you think about, I'm sure maybe in some of these other Inspire sessions, you've learned about this concept of like neuroplasticity, right? Or the brain sort of making these new connections around the area that was damaged by the stroke. Well, that not only takes time, but it's a process of elimination, right? I always tell people as your brain is trying to find those detours, those new roads around the damaged area, your brain doesn't have GPS, right? If you're trying to find a new route in your car, right, and you've got your phone there with the map up, if you take a wrong turn or you run into a detour, that GPS on your phone, it immediately tells you the new way to go, right? It says, oh, this is the way you get around, right? You took a wrong turn, we'll get you right back on course, right? Your brain can't do that. As your brain's trying to work around that damage area of the stroke, it's trying all kinds of routes, right? It's just like, oh, we can't get through there. I don't know, take a right, see where that takes us, right? And so sometimes when you're trying these tasks in your recovery, like you're working with a physical therapist or a speech therapist, you're working on something and you're just not getting it, a lot of times people will think that's a failure, right? It's not. That's really your brain going, okay, that route didn't work. Next time we'll try a different one. Next time we'll try a different one. Next time we'll try a different one, right? So early on, this adjustment naturally includes a lot of quote unquote failure, but it's really the brain trying to find those right routes. And the last thing I always try to hammer about this adjustment being a process is that everybody, especially early on in recovery, is focused on what we call that, recovery of function, right? I want to get back. I want to get back everything that I lost from the stroke. That is a wonderful goal. That is what we should be focused on, right? If you can't walk, we want to help you walk. If you can't talk, we want to help you talk, right? And so you work on that recovery of function, right? But there's this other part of recovery that's equally important, and that is that adaptation of function, right? Maybe I can't do everything the way that I did it, but can I learn new ways to do things that work, right? Maybe they're not as fast. Maybe they feel awkward. I don't like them as much. But if we ignore that, you're going to miss all kinds of opportunities. So it's both working on this, getting your functioning back and learning new ways. And that just is a process. It just takes time, right? So let's talk a little bit about some of the different kinds of things from a mental health perspective that we have to adjust and adapt to. And the big one, of course, that we're going to talk about today is different kind of mood changes that happen after stroke. These are really important, these mood changes, because when people are feeling depressed, when they're feeling anxious, when they're feeling irritable, right, they don't have great recoveries. It's hard to get up every day and get to that therapy appointment, right? And to do the routines that you need to do and do those home exercise programs when you're not feeling well, when you're not motivated, when you don't have energy, right? And when you don't get a great recovery, of course, you don't have as good a quality of life, right? You may not gain as much function back. You may put yourself at risk, right? If you're not being healthy, if you're not doing the things you need to do, you put yourself at risk for another stroke. And, if people have ongoing strokes or they get really, really serious mood problems, I mean, the reality is that not only does that contribute to quality of life not being great, sometimes it contributes to the end of life, right? So these are really, truly important things to focus on in recovery. So the first one we're going to talk about, of course, is post-stroke depression, right? So depression, again, like I said, these are really common things that people encounter after stroke. It's a little bit hard to make sense of the data around this because, of course, strokes are so different, right? People have them at different ages and different areas of the brain and different types of stroke and sizes of stroke. But if you look at all strokes together, somewhere in the neighborhood, I always tell people, somewhere in the neighborhood of 25, 30% of people are going to have some symptoms of depression after stroke. Okay, so about 1 in 3, somewhere in there, 1 in 4. This usually happens about 3 to 6 months into recovery. Not always, but that's kind of the peak time when people are maybe out of the hospital and their therapy's kind of ending. And now they're like, okay, this is life, right? I've got to face it. They're still going to have some improvement, but that's when it tends to set in. It generally doesn't last. It generally resolves itself, sometimes even without treatment, oftentimes quicker with treatment, but it generally resolves around that 1 to 2 year mark, but not always. Sometimes it's persistent and sometimes people don't get treatment. It's a little more common in women than men. These data are also a little bit confusing, I think, at least in part. There's some sociological differences there. Women face different challenges than men, but also women are much more likely, I think, to seek help and actually acknowledge their feelings than men. So maybe we just know about it a little bit more than women. It presents a little bit differently, generally speaking, depending on if your stroke was on the left side of your brain or your stroke was on the right side of your brain. And I'm going to talk about this in terms of a right-handed person, because about 90% of people on Earth are right-handed. This can be flopped if you're left-handed, or it can be mixed up if you're left-handed. But in a right-handed person, when you have a stroke on the left side of your brain, it's more typical that the depression, the anxiety will come on earlier in your recovery. And it's the opposite for a right-sided person. Right-sided folks, sometimes they struggle with attention and they struggle with noticing new, novel things. And so they may think they're doing really well early in recovery, and then they get home and they get faced with these realities. And so their depression and anxiety tends to set on a little bit later. So it's just a little bit different depending on where people had the stroke. So what are we talking about with depression? I think we all know what depression is, generally speaking. But these really are the criteria right here, right out of the DSM, the big book, the Bible that we use as doctors to diagnose people with these things. So, it's what you would guess, right? It's that low mood, that sadness, emptiness, hopelessness that lasts, we say, for 2 weeks or more. Okay. And then you have several of these other symptoms with it. So this loss of pleasure or loss of interest in things, like, I used to enjoy this, it used to be a lot of fun, and now I just don't care. Now it doesn't give me the same kind of good feeling. Um, People have a lot of rumination, right? They start thinking negative things and they just kind of can't get off it. They can't get it out of their head. They have a lot of guilt. They beat themselves up for things, right? They're often feeling fatigued and having a lack of energy. You'll see even a slowness or sometimes a restlessness in their movement, in their speech, in their behavior. You can see either weight gain or weight loss, uh, increased sleeping or decreased sleeping, and then a real effect on their focus and their concentration. Those are kind of the hallmark signs of depression. And of course, when that is really, really significant and really serious, sometimes people start to have thoughts of, not wanting to live anymore, wanting to end their life. And so suicide is always a serious symptom of depression that we're looking out for. But these are the main symptoms, okay? We also see a lot of anxiety after stroke, okay? It's not quite as common as depression, but it's still there, okay? 20 to 25% of people are having some significant anxiety. Anxiety and depression are two very similar things. They run together a lot. In fact, they run together about 80% of the time. If you have some of one, probably going to have some of the other. But anxiety is more of that worry, right? That excessive worry, that restlessness, where we have racing thoughts, we feel kind of edgy, right? Our body's going, we're kind of irritated. There's a lot of muscle tension and tightness, headaches, things like that. People start to feel shaky or kind of keyed up. They have a lot of upset stomach, GI issues. That's sometimes a symptom people overlook. Again, they're often not sleeping well, not focusing well, and they feel very fatigued, right? And so when you think about the symptoms of both depression and anxiety, it's tricky to diagnose in stroke because you can see there's a lot of overlap here, right? I don't meet anybody that's had a stroke that doesn't have some level of fatigue, right? It's common. Like I said, your brain's firing like crazy. It's burning a lot of glucose, right? You're doing a lot of things after stroke and it's just going to be tired. You know, a lot of people have problems concentrating after their stroke, right? There's changes in sleep. So a lot of these overlap and you need to sometimes really take a good look at them, really speak to someone who's a professional to kind of sort these out. So what causes these things after stroke, or what causes them even in general in people that don't have stroke, right? We kind of group that into four main categories, right? So the first is biological, right? How we're wired up, right? The genes we have, the way our brains wired up. And so obviously, if you have a change in brain structure and brain function, like you have in stroke, right? You have a bleed up there, you have a blockage up there, some cells get affected, and the brain's working differently, that can lead to some anxiety and depression. So there's that biological piece. And then there's this psychological aspect, right? How we think, how we feel, right? What our personality is like. That can affect whether or not people experience anxiety and depression. You know, some people, you know, are just, I'm probably one of these people. I'm kind of a live wire, you know, I'm kind of happy. I'm kind of like, you know, wear my emotions on my sleeve a little bit. You know, some people you gotta like hit them with a taser to get an emotional reaction out of them, right? So people are just different. And sometimes that affects how their mood presents. Um, and then sociologically, right? What people go through in life, you know, how you're raised, where you grow up, what you experience, what happens to you, what stressors you face. These things all impact our mood. And then lastly, in the spiritual sense, I don't mean necessarily like a religious sense, but just that sense of meaning, that sense of purpose, how people see themselves and the world and other people. All those things affect their mood. So those are the main kind of drivers of depression and anxiety. There are different risk factors, particularly after stroke, right? If you're going to be in that category of people who develop these symptoms, it's much more common if you had some kind of anxiety or depression or mental health issues prior to your stroke. It's also much more common if there's some of that in your family, right? Because again, we know there's a biological impact, right? These things tend to run in families. How severe your stroke is, right? Where it was, how big it was, that can affect more things, right? Including your mood. How many physical challenges and cognitive challenges people have after their stroke, right? Those are harder to deal with, the more of them. And then a big predictor of people's success after stroke is that social support they have around them, right? When people don't have a lot of connection, don't have a lot of help, they're not able to reach out, it becomes a risk factor for developing these kind of mood concerns. One thing people often ask me is like, okay, well, you know, you're saying it's normal to have some ups and downs after stroke, right? Nobody should be happy, right? If I walk into the hospital here and I walk into someone's room and they're just happy and cheery after their stroke, not a great sign, right? That's not normal, right? So how do we know when someone's experiencing just these kind of normal ups and downs that we would expect them to have versus they're actually having a more significant mental health diagnosis like anxiety or depression that we want to really treat? And I sort of break it down like this, right? I talk about unpleasant feelings, right? Versus depression and anxiety. And so if you look at these two columns here, unpleasant feelings are just what they sound like, right? It's feeling sad, feeling, scared, angry, irritable, guilty, embarrassed, all those things, right? And so again, number one under unpleasant feelings is these things are completely normal, right? You'll never meet anyone on earth who hasn't felt all of those things before, right? But with depression and anxiety on the other side there, these are quote unquote not typical, not normal, whatever that means. And the reason they're not is just because they're more intense, right? So for example, if we're talking about anxiety, right? Like I could have some anxiety around giving this presentation today Maybe I'm sitting around last night like, oh my gosh, what am I going to do? I better make sure it's all ready. I'm a little nervous. Maybe my heart's going a little faster, right? Maybe I didn't sleep great last night. I was okay. But let's say this could happen, right? That would be very normal, right? But with anxiety, like if I was having like a panic attack, right? Where like my heart's beating so fast I'm having a heart attack, right? Or it feels like I'm having a heart attack. I'm shaking, right? I'm not sleeping at all, right? That's more intense. If I came and I said, Mickey, cancel the presentation, I can't go out there, right? I can't do it. That would be more intense, right? Like, being sad is not the same as being suicidal, right? There's a big difference. So depression and anxiety, they tend to be more intense. They happen more frequently, right? Like it's one thing to be sad for a day or two. It's another thing to be sad for, most every day for 2 weeks or more, right? And depression and anxiety tend to last longer. Okay. They just don't go away. So these symptoms are just much more serious than the kind of normal symptoms that we have with unpleasant feelings. The second thing is unpleasant feelings, even though they're not fun, our feelings have a purpose, right? We have them for a reason. If they didn't have a function, if they didn't have a purpose, evolution would have got rid of them a long time ago. But we all still have them, right? And the purpose of our feelings, the reason any of us have feelings, is because this is our body's way, our brain's way of telling us, hey, something in your life, something that matters, something that you care about, it needs attention. Something's not working right, and you got to pay attention to it, right? And so when I have anxiety before a presentation, that's actually helpful, right? That's my brain telling me, hey, dude, there's going to be people there. They're going to be listening to you. You might want to give them some good information. You might want to actually prepare for this, right? You better sit down and you better put it together, right? So that anxiety can kind of motivate me, right? It can be helpful, right? If that anxiety is intense, like that panic, like I was saying, like, oh my gosh, I can't breathe, and it's like someone's standing on my chest and I got to go to the hospital because I think I'm having a heart attack, that is not helpful, right? That's not helping me get the presentation done, right? In fact, that's doing this third thing is it's causing this functional impairment. It's getting in the way of my life, right? It's keeping me from doing the things that I need to do. Whereas like these unpleasant feelings, they're not going to stop me from giving the presentation, right? I might come out here, I might be a little nervous, but it doesn't last very long. I start talking, I calm down, the presentation ends, everything's fine, right? So it's really these factors like, are they intense? Are they happening all the time? Are they lasting a long time? And are they really getting in the way of your life? That's when you want to seek help. That's when you want to go, I think this is more than just the normal ups and downs that we all have. Okay? So the other thing that can happen is sometimes people won't have like a diagnosable anxiety or depression, but many people will see just general emotional changes after stroke, right? So it's very common for initially, especially, it's very common for people's emotions to kind of be all over the board, you know, to feel sad, to feel scared, to feel guilty, to feel all kinds of things. So we often see a lot of mood swings after stroke. We see difficulty controlling their emotions. They just get released really easily. I like to say they're just kind of close to the surface, right? So people often tell me, they're like, it'll be these stoic men that are like, I haven't cried in 40 years, and now I'm watching like some commercial on TV, and it's like bringing me to tears. And it just feels really uncomfortable and really awkward for them. And that's because it's just harder to control the emotions. They come on stronger and they tend to come out easier. So that is very common too, that we'll see this range of emotions and we'll see a difference in kind of how they show up and how they're expressed. There's one kind of interesting thing I want to talk about that maybe some of you have experienced or you've heard of that can happen after stroke as well, and we call that pseudobulbar affect, or this kind of pseudobulbar emotion. So that's kind of a mouthful, but it just means that people have this unusual kind of display of their emotions, right? And so their emotions come out quite strongly when they don't want them to. And so sometimes people will call it like a reflexive or like an incontinent emotion, where it just comes out involuntarily and it often doesn't match the situation or what the person is really feeling. So person might say something, just completely mundane, like, oh, I had a hot dog for lunch, and they start crying. Or they might say something really sad, like, oh, geez, my wife is really sick and I'm worried about her, and they start laughing, right? And again, it's just having to do with how that emotion is released in the brain, and it's not coming out like cleanly, right? So, think of again, maybe you can't move your arm normally after a stroke. Well, sometimes people can't move their emotion in the same way that they used to after a stroke. This is usually, it usually involves brainstem strokes or strokes that involve the connection between the front part of the brain and the brainstem. There are some medications that are helpful for it. In fact, there's one, Nuedexta is an FDA-approved medication just for this. Some of the antidepressants, like what we call the SSRIs, like Celexa and Zoloft and Prozac and Lexapro, those things can be somewhat helpful. Oftentimes, the symptom does tend to get better with time. It does tend to lessen, but it's a matter of learning what it is, how to understand it, how to communicate it to others so they don't get worried about you. Just say, hey, this might happen and it's okay. There's a couple other strategies sometimes that we can teach people for managing this, but something to be aware of that, again, emotions can be jumbled after stroke. Besides these, kind of diagnosable things or these brain things that happen with emotion, stroke really affects a number of other areas too that impact our daily life, right? Like the biggest one probably that you think of is these cognitive changes in our thinking, right? So memory, attention, concentration, being able to plan, organize, make decisions, um, not seeing things quite accurately or hearing things quite accurately, right? Not being able to do things as quick, not being able to do things as long without getting tired. These are all significant cognitive changes that really have an impact on people's lives. Relationships change after stroke too sometimes, right? So socially, things can be quite different for people. They might have trouble communicating with others, right? Saying what they think and feel in the way that they want to. They might not be able to do some of the activities that they used to really enjoy. So they don't get out as much, right? Because that's not as easy. And it just changes sometimes the way that we interact with other people, and that can definitely have a big effect on people's mood. Lastly, a lot of times a stroke will just change the way we see ourselves, right? Changes that identity, that self-image. So, we have these new limitations that we have to figure out how to work through and work around. There's changing roles, right? So maybe I was the guy that always fixed everything in our house, and now I can't do that now because I can't work the wrench or the screwdriver the same way, right? Maybe I'm not able to return to work or return to the same role at work, right? So there's a lot of role change. Oftentimes people need some extra help. They can't do all the things they used to do, so they don't feel as independent, right? Maybe they're not able to drive, maybe they're not able to cook or clean or do the things that they used to do for themselves. And there's a real loss. There's a real grieving that people go through as they're learning to cope with these new ways of doing things. And so it just can really affect how we see ourselves as a person, right? And how effective we feel. And so that's a big thing that changes with people after stroke as well. So what can we do about all this stuff, right? What can we do about anxiety and depression and emotional changes, behavioral changes? Well, there are a number of things that work. Okay, so if we're talking about just anxiety and depression, I'll tell you about kind of the big evidence-based things from the studies that help with anxiety and depression. Okay, so treatments for depression. Number one, the most effective treatment for mild to moderate depression, people that aren't like severely, severely depressed, really is talk therapy, right? I'm not saying it just because I do that. That's what the data says, right? So therapy really has kind of two main benefits, right? Number one, it's sometimes nice to have a private, confidential place you can go where someone's going to listen. They're not going to judge. They're going to really work hard to understand things from your perspective, right? So therapy is just supportive. It really can be cathartic. It can be a good source of support for people, right? And then second, hopefully, when you kind of identify what the challenges are they're bringing into therapy and you develop a plan to work on, right? Hopefully, we can also teach people some skills. We can give them some tips and tricks. We can give them ideas of things to try to work through the challenges that they're having. So there's some support and then there's some skill building too. The other treatment that is definitely effective for anxiety and depression is medication, right? So I'm not a pusher of medication. I think it's an individual choice, obviously, unless people are like severely depressed, then I'm saying, you need to take some meds. But one thing I want people to know about medications, the common medications that we use for depression and anxiety, is these are generally speaking pretty mild medications. Okay, these are not like the antipsychotic medications that we use for like schizophrenia and things, the mood stabilizers that we use for bipolar. Those are strong agents, and those have a lot of difficult side effects sometimes. The antidepressants, like the SSRIs I was talking about earlier, these are very commonly used throughout society. If you look at the top 10 drugs that people prescribe in the US every year, you got your blood pressure meds, your cholesterol meds, and you're going to have a couple antidepressants in there every year, right? So you would be shocked, first of all, to know how many people are on these. As a psychologist, I get friends and family all the time that come up to me and be like, yeah, I got on a little of this. And I'm like, wow, I had no idea. So one, these are pretty common. In fact, they're so common that they're more commonly prescribed by primary care doctors and OBGYNs than they are psychiatrists because they're not difficult to manage. They're quite safe. They're not addictive. There's not a whole lot of complication to them. And they have, like all meds, they can have some side effects, like typically like dry mouth, upset stomach. Usually people adapt to that or they don't have them at all, and they're tolerated quite well. So medications, if people need them, they are an evidence-based treatment. They can help. And I don't want people to think of them as like, oh, geez, I'm putting some really strong, toxic, unnatural thing in my body. It's really something that can be helpful. The next one is exercise. Exercise, this sounds like a simple, easy thing to tell people to do that's good for them. I'm telling you, there are large studies at major universities that will tell you exercise is almost as good as therapy and meds when it comes to treating depression. It really is an evidence-based treatment, right? So working with your PT, getting that home exercise program, doing whatever you can do. PTs are great at modifying things, right? Working around anything. And so exercise is an evidence-based treatment. It works almost as well, and the effects of it actually last a little bit longer than the first two. So it's a great treatment. And then just stress management techniques. We'll talk about some of these specifically, but finding ways to calm, finding ways to manage your thoughts, those intense feelings, kind of clear out the stress in your brain. Super helpful, particularly for anxiety, but also for depression. And then last, again, that social support, right? Family, friends, support groups like this, working with rec therapy, finding out how to get some of that fun and enjoyment and connection back in your life. All great treatments for anxiety and depression. There's a lot of stuff you can just do on your own too, to be honest. If you don't want to come see a therapist or it's difficult to get into one, which it is, there's a lot of just mindfulness practices you can do, right? These calming things, the breathing, muscle relaxation, guided imagery, yoga, tai chi. I don't care what people do, right? The data will tell you that it's all good. It's just a matter of being consistent with it, right? I always tell people you got to try it. You got to stick with it. You can't exercise and go to the gym one day and be like, man, I think I'm ripped, I've lost 30 pounds, right? You gotta be consistent. Same thing with this. You gotta try these things and you gotta stick to it. And if you do, they can be so helpful. Really, I think when it comes to general health, right? I think we all should exercise. I think we all should try to eat well. I think we should all sleep well. And if I had to pick a fourth thing to put on that list, I think it would be we should all have some kind of stress management practice that we do regularly. It's great for your mind, it's great for your mood, it's great for your sleep, it's great for your general health. So, oh, am I going the right way or not? Yes, okay. Um, and then just for managing your emotions, there's a lot of simple, helpful things you can do, right? Some people love journaling. Just getting stuff out of your head, getting it down on paper, taking some time to think about it, just dump it, get rid of it, right? Is so helpful, right? Identifying, hey, where are the instances that I'm really struggling, right? What triggers me? You know, are there certain things that are really setting me off? Number one, can I just avoid those things? Do I need to be doing those things? If I don't need to be doing them, avoiding avoidable triggers is one of the simplest things, right? The other thing you can do is you can prepare for unavoidable triggers, right? If there's things that I have to do and I know they're difficult, can I plan ahead? Right? Can I get a really good night's rest? Can I make sure there's nothing else on my schedule that day? And then I'm leaving some time to recover afterwards, right? Can I bring someone along to help me? Can I check it out in advance so I know what I'm going to face, right? Can I practice it? Can I do things differently, right? So that's a really big thing of understanding what those triggers are and really planning and preparing for them. And then a big one that I talk about with people a lot is just really practicing gratitude, right? It's so easy. We are naturally inclined to find all the things wrong with life and talk about how things are so bad. We need to work at really practicing like what we're thankful for and what is going well, even when they're just these, everyday fun, simple little things. We need to really recognize that those positive influences in our life. And then lastly, just daily structure, right? Especially for a lot of these cognitive challenges that people have, how you set up your day makes a big difference, right? So if there's one thing I could hammer after stroke with people, it would be work really, really hard at doing one thing at a time. One thing at a time, right? When you're walking, walk. When you're having a conversation with someone, have a conversation. When you're on the phone, right? Don't try to be doing nine things at once. It's a problem for all of us, right? Our brain is not set up to do that. When our brain is multitasking, what it's really doing is it's really rapidly switching from one thing to the next, right? That's why, like, texting and driving is so dangerous, right? Because you're not texting and driving. You're either driving or you're texting, and then you're driving and then you're texting, right? You're doing one or the other. So try not to multitask, try to do one thing at a time, try to reduce those distractions, right? Turn the radio off, turn the TV off, background noise, all that stuff. Take breaks, right? Set time limits so you don't fatigue, you don't wear out. Break things into smaller tasks, right? Write things down, use calendars, alarms in your phone, get good sleep, be as healthy as you can. A lot of these things are things that our OTs and PT or our OTs and speech therapists really work on. But these are just good things for setting up your day that can really help with your mood. And then lastly, just, our lifestyle adjustments, right? Stroke prevention, right? Managing all those things, my blood pressure, my diabetes, my sleep apnea, right? My cholesterol, my exercise, my stress, right? Getting in a routine, trying to get into patterns, into healthy habits where we're doing the same thing every day. So it's not so hard. It becomes more second nature. A lot of what I work on with people sometimes is setting realistic goals, right? Really setting good, achievable, challenging goals in the right way. And then just practicing all that self-care we talked about, right? Sleeping, eating, meditation, all that stuff. Social connection is another huge one, right? You really need to maintain and nourish the important relationships that you have in your life. Social connection is one of the biggest predictors of success after stroke. And so, these kind of things, again, joining a stroke group, right, can be super helpful. Getting your family involved so they are educated and understand, and really learning how to talk to people about what you need, right? Learning how to ask. People will not just get it, right? Don't trust that they will so much. Especially, I tease the gals in therapy about this all the time. They're like, well, don't you think he should have just known? I'm like, no. Like, have you met men? Like, like we don't know, right? You gotta tell us, right? So you gotta ask for what you need, right? And really lean into those relationships in your recovery. The last thing I talk to people a lot about is building resilience, right? Recognizing, hey, what is really hard for me? What is it that I have to work on, that I have to get better at facing, right? And how can I practice that? So, hey, what is really challenging for me? Um, Learn about your recovery, right? Understand your stroke as best you can. Talk to your doctor, talk to your psychologist, your neuropsychologist, whoever about, hey, where was my stroke? What kind of things do we commonly see with that type of stroke? What things will be particularly difficult for me, right? Um, have a plan, right? For when things go bad, who are the people you can call? What are the things that you do that make you feel better, right? What seems to help? So have a plan for how to seek help when things do go bad. Again, we talked about communicating your needs clearly, setting boundaries, right? So like, again, if there's things that I know wear me down, I've got to put a time limit on it, right? There's people in my life that I know are not particularly helpful and don't really understand what my needs are. I maybe don't need them in my life so much, or I need them in smaller doses, right? Um, Keep track of your successes, right? Celebrate those improvements, track how you're changing, ask your therapist for updates like, hey, whoops, sorry. What's really getting better, right? And then plan for the future, right? We all do better when we have things to look forward to, right? So I have a lot of people with stroke that will tell me, well, I can't do this anymore. I can't do that anymore. And I'm like, why not? Right? Are you sure? You might not be able to do it the way you want to do it, or the way you used to do it, but let's figure it out, right? Let's plan some things that you can do, right? So that you can look forward to them. Lastly, I want to talk just a little bit about care partners, right? Husbands, wives, family members, loved ones, because this certainly affects them too, right? So I think a lot of you are probably stroke survivors, but maybe this could be a tip for the people in your life. And if I had one tip for people, I would say practice just listening, right? Um, be patient when people are talking to you about their issues. We have this natural tendency, all of us, we call it a righting reflex, right? Like RIGHT. Like someone tells us a problem and we go, oh, here's what you should do about that. Here's what will make it right, right? Well, there's nothing that's going to just go back and make your stroke right, you know? So I tell people you need to just practice listening and understanding rather than trying to fix it all the time, right? And so what's better is to do the second thing. Just do a lot of empathizing, a lot of validating, right? Really try to imagine how difficult that is for people to deal with what they're dealing with. Try to understand it from their perspective. Validation doesn't mean you agree with someone. It just means I hear you. I get what you're saying. That makes sense to me from your perspective, right? That's what people want. People don't want me as their therapist to feel what they feel. People want me to understand what they feel and get it, you know? Um, Other things, of course, simplifying routines and activities, right? Making things predictable, offering to help when they can, right? But letting people be independent in every way that they can that's safe, not jumping in and doing everything for them, right? Um, and just planning ahead to, you know, do fun things, right? Planning leisure, planning connection so that everything in your recovery is not about doctor's visits and appointments and exercises, right? That gets old. You got to take a break from it once in a while. And the care partners themselves, they need to take a break, right? They really need to practice that respite and getting away from things, recharging themselves, and using some of those resources that are out there for help. So those are some good tips for care partners. And I know we're kind of getting towards the end of time, so I have a few more things, but I have some resources maybe that I can send out on like mindfulness and things like that we were talking about for self-help, but I want to leave some time for questions.